Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the way in which the government are, predictably I'm afraid, still insisting on sacrificing the vulnerable elderly in their COVID second wave strategy when they should be shielding them. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, I saw a bit of an interview Sunday, Michael Gove, where he was representing the government's position on the care of the elderly during the first COVID wave and now. One of the scandals back in spring was the news that the government were telling hospitals to discharge patients as soon as possible, even if this meant discharging COVID positive patients into care homes. They basically, the regulation said, we don't require them to have a negative COVID test. So some were known to be positive, but actually a lot of them just weren't tested because it wasn't needed, so they just didn't know. Now, the policy lasted a long time, well into lockdown, and it resulted in a catastrophic death rate amongst the very part of the population that should have been kept the safest. The government said they threw a protective ring around care homes. This was a deeply offensive lie. On Sophie Ridge, it was put to Michael Gove that a major failing during the first wave was not protecting care homes. To this, he grunted his agreement. She then said that the infection rate in care homes was higher now than at the peak of the first wave. Again, indicated his agreement. Now, before getting on to the more coherent parts of his response, let's just acknowledge that Michael Gove was not disagreeing, it seems, that a major failing during the first wave was throwing COVID positive patients into care homes. He didn't dispute the fact at all, or insist that it was a mistake. You know, second, and I didn't know this at the time, so we now have a higher rate of infection in care homes than we did during the peak of the first wave. Now, the first wave, 20,000 care home residents died to COVID. They were sacrificed by the government. What damage is it going to do in this wave, which hasn't even reached the peak yet? Gove tried to say that the issue really was more about people working in more than one care home. Okay, so it wasn't discharging COVID positive patients from hospitals into care homes then? I mean, no, apparently the thing to focus on was care home staff moving between care homes. And yeah, okay, I can absolutely see that that would be another source, but then you sort of think about that and you go, okay, but if that was the issue, how would that be a major problem if those staff weren't contracting the infection from one of those care homes they worked at? That's what it means, isn't it? If you're saying it's care home staff moving between care homes, you're saying that they've picked it up in that care home. Because he didn't say it was about care workers as such. He wasn't saying that they were picking up the infection from home or supermarkets and then taking it to work with them. It was the movement between care homes he highlighted. That was the problem. But that is only a problem if the worker is picking up the infection from the care home, in which case it's already there amongst a vulnerable population. We needed to stop it getting in there in the first place. That was the whole point. Now, sure, like I said, I'll accept that a care worker could pick up an infection in a care home, and especially if they've not been given enough PPE, it's quite likely. They could then be an agent who transmits it to a different care home, but you're not telling me this is a more important factor than discharging lots of COVID positive patients into care homes. The reason why Michael Gove wanted to put emphasis on this is because nobody in their right mind would blame the government for, you know, care workers bringing it in accidentally by working in multiple care homes, because that was just the working practice at the time. But releasing patients into care homes without requiring a negative COVID test, that was a deliberate government policy. That wasn't just an oversight, that was a deliberate policy inserted that had a very predictable and dire consequence. Now, when Michael Gove decided to use actual words in defending the government's position during the COVID second wave, Michael Gove wanted to make 3 points, he said. 3 points. He ended up making 4, but you know, he's not the best at maths. The first one, he said, it's about people moving between care homes, and then he said, but we have protocols in place now to prevent that. Okay, you have protocols, that's great, you've learned from the first wave, that's all we can ask. Fantastic. But here's the thing, you've just been told and you've just agreed with the notion that the rate of infection in care homes is already higher than it was during the peak of the first wave. So these protocols don't really seem to have worked, do they, Mr. Gove? This is a serious issue now. You know, we know how deadly COVID was in care homes during the first wave. If the rate of infection is already higher than during the worst period of the first wave, what are we going to do to prevent that higher rate of infection turning into a higher death toll? Because whatever has been put in place has clearly not been enough. There is a lag between infections and deaths, so the rate of death is still not going to be that high. But we're going to go that way if we've allowed the rate of infections to get that high. That's why the new lockdown announced may curtail the rising in new infections. When it starts, it's still not going to start for the best part of a week. But the deaths won't tail off for weeks to come because that's already in place now. They're going to happen. That's in place. What are we going to do to try and at least save as many lives as possible in care homes as a result of our continued failure to shield vulnerable residents? The second point he wanted to make, although this was really 2 points, he said that the government had supplied hundreds of thousands of pounds to care homes to help staff isolate, and also that they were routinely testing care workers. Now, the first point, first of all, 2A we may call it, hundreds of thousands of pounds to care homes to help staff isolate. Now, there are 21,273 care homes in the UK. Now, if we say they provided, now what's hundreds of thousands of pounds? Is that, it can't be more than £900,000, because if it was more than that, you'd say a million, wouldn't you? £900,000. So we'll be generous to begin with. Any more, he would have said £1 million, so it's no more than that. Now, if you divide that out, that equates to about £414 per care home. That's not going to cover much staff isolation, is it? That's not going to compensate many wages. And let's be realistic, it won't actually be £900,000. If he says hundreds of thousands of pounds, it's more likely to be at the lower end. The government consistently, when they're talking about their spending, always phrase it in a way to make it sound as impressive as possible. If it were £900,000, he would call it nearly £1 million. It's much more likely to be a few hundred thousand, £200,000 or £300,000. In which case, that'll work out at not much more than £100 a care home. Now, here's the thing, average care home has 47 members of staff, in England at least. £100 wouldn't even cover a full period of isolation for a single member of staff. Not 47 staff, they're not all going to be having to isolate various times, but a few of them are very likely to. It's a hive of infection apparently in our care homes. So you're going to get a few having to isolate on average in each care home. That money per care home does not even cover a full period of isolation. Nowhere near covers a full period of isolation for even a single member of staff. So that money is a pathetic drop in the ocean. It doesn't do anywhere near enough. Doesn't come close to allowing for isolating staff. And this is important because care home workers tend to be poorly paid and exactly the sort of worker who cannot afford to be isolating without financial support. And we've talked about this before. The problem with having workers who cannot afford to isolate is they are, you know, they can't pay the rent, they can't afford food. They are much more likely, therefore, to not take a test or to downplay any symptoms they may develop. Any number of things that prevents them putting themselves in a position where they may be asked to isolate. They may not use the COVID app, for example. They may not engage in anything that might cause them to be told to isolate. And if they avoid getting tested when they need it or, you know, whatever else, they could, of course, be at increased risk of infecting care home residents. It is absolutely vital that nobody fails to engage in the test, trace and isolate system because of the fear of it financially ruining them. And that financial support is clearly not there in the country. It's clearly not even there for care homes using Gove's own figures. He also said, like I said, that care home staff were being tested weekly. They are not. It is a fact that we know the bulk of our testing is for people with symptoms. This comes out very clearly in the Public Health England data. There is no routine testing of healthcare staff. How do we know this? Two things. First of all, we can just look at the figures. There are just over 1 million care home workers in England. We are not testing even 1 million people a week speculatively. We're barely testing 1 million people a week altogether. In fact, it's probably lower. It's very difficult to tell because the government do not publish the figures of how many people are tested. They only publish how many tests are processed. Now, you may think test process is the same thing as people tested. It's not, for a couple of reasons. First of all, the government have this cunning idea of counting each person tested twice, because the stick that they shove up your nose and down your throat, it's got 2 ends, 2 tests, 2 bits of processing. So when you look at the number of tests processed, you can immediately halve it. Then there's the fact that some people may be tested more than once. But just in terms of the halving of it, if you take that, we're not testing more than 1 million people a week using the government's own figures. But to routinely test care home workers, we'd have to be testing 1 million a week just for them. Not even counting people who have symptoms or any other, other frontline key workers, for example, doctors, nurses, anything like that, teachers, supermarket workers, any of the other people who may be exposed, people who work in restaurants, pubs. There's lots of workers who are at high risk of asymptomatically transmitting this thing to a large number of people. They're not routinely tested. The other reason we know is it's simple. Care home workers tell us they're not being routinely tested. That's what they say, they're not. Some may be, they're not all. Now, given that, we hear from care home that the staff are not being routinely tested, this is just an outright lie, even without me playing about with the numbers. But the numbers also back it up that it's a lie. Then the third thing he tried to say is he said, look, anyone who's discharged, because he didn't deny that they're discharging COVID positive patients to care homes. We're still doing that now. He was quite happy to admit that. But he said, but here's the thing, they'll be placed into a secure and isolated setting. But no, they won't. Again, we've been told this by people who work in COVID wards in hospitals as well as people who work in care homes. You can do it in a hospital. You can have isolating bubbles in a hospital. You cannot do it in a care home. It's not possible. You can put them in their own room and not let them get out of that room. That doesn't stop the infection spreading around the care home. They've still got to have staff go in there, even with PPE, assuming they have enough PPE now. That remains to be seen. That doesn't cut the risk down to zero. You still get that infection out, and all you need to do is have that resident infect a single person that sees them, a member of staff, and that person, it becomes infectious without realising it, no symptoms, and they then infect the rest of the care home. It's absolutely outrageous. You cannot, it's been said time and time again by the experts, you cannot protect a care home from an infected resident. You cannot do it. Closing a door, putting a door between them and the rest of the population doesn't do that. So the bottom line is the government are making no denial of chucking COVID positive patients into care homes. They've lied about the measures they put in place. Some of the measures just don't exist. The other ones, they've inflated the effectiveness of those measures. His statement in the interview was just designed to give comfort to those who will not think too deeply about his answers. And comforted they will be, no doubt, until this policy hits them personally. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.